Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. This is your weekly minisode where we'll provide a brief update on local public health news. Tom, what's up in public health this week?
February is Heart Health Month, and according to the CDC, heart disease is the leading cause of death in the United States, killing more people each year than cancer and accidents combined. And with February being Heart Health Month, we wanted to focus our attention on one factor responsible for 1 in every 4 cases of this disease, and that is using tobacco and nicotine. With that, today we have with us Destini Hall, our Senior Health Educator for Tobacco and Youth, and Nina Wickens-Bhowmik, one of our Population Epidemiologists. They're here to talk to us about nicotine prevention and cessation. Destini, how exactly does nicotine use impact our heart health?
Yeah, good question, and thank you for having us here. So the bottom line is that although the impacts of nicotine products such as e-cigarettes or oral nicotine pouches are still being studied, they still contain highly dangerous toxins that are highly addictive to the mind and body. In addition, as we talk more about heart health specifically today, tobacco smoking is the most important modifiable risk factor for cardiovascular morbidity and mortality, according to the American Heart Association. And on average, smokers unfortunately die more than 10 years earlier than a non-smoker.
If someone does stop using nicotine, does their heart health improve, or is the damage already kind of done?
I definitely want to be clear that myself and my team are not medical practitioners, and so my recommendation would always be to speak with your primary physician about your specific heart health and also your medical plan. And there are so many different factors that influence an individual's heart health. So just want to start with those pieces. However, what we do know is that after a smoker quits, in the first 20 minutes, their blood pressure and heart rate drops. After 12 hours, the carbon monoxide in the blood returns to normal. And then between 2 weeks to 3 months, your breathing improves and blood circulation increases. And after 1 year, your risk of heart disease is cut in half.
What strategies are believed to be the most effective in preventing nicotine use?
Starting education young in a both non-judgmental and non-punitive environment. From the youth that we have worked with throughout the county, it is rare that a young person has not ever heard or seen a vape before. Youth are finding out and trying nicotine products, and studies show that 7% of young people in Larimer County have reported vaping before the age of 13. This is according to the Healthy Kids Colorado survey. So a project that our team is working on now is our Breathe Easy education campaign. This is a nicotine and tobacco prevention education curriculum for students from elementary through young adulthood. And the curriculum is aligned with Colorado Comprehensive Health Standards and includes slide decks, activities, worksheets, and lesson plans for teachers, counselors, community champions, and trusted adults looking to partake in more education. And so our hope is that the more that we are pushing this education into school curriculums, in homes, earlier the better, so that eventually young people will have the tools and the knowledge and the resources that they need to make the healthiest choices for themselves growing into adulthood.
Out of curiosity, what kind of things are covered in the curriculum?
Pieces in the curriculum all the way from what is a vape, right? So what are the harmful toxins and chemicals inside a vape or something like a Zyn, right? All the way to the marketing that comes from big tobacco industry, right? So really wanting youth to understand that this didn't come from thin air, right? These are industries that are working hard to sell their products to youth. So the more that they know, the more they're like, oh, I don't want to be manipulated by anyone, which makes total sense. And then we're seeing that hopefully they're less likely to buy because they're like, yeah, this doesn't feel good.
What tools and resources are available for people, though, who currently use nicotine that want to stop?
Yeah, so luckily there's tons of resources specifically in the state of Colorado that are available to folks who currently smoke. So resources such as the Colorado Quit Line that also has incentives for folks who are on Medicaid. So if you engage in the Quit Line, for a certain amount of calls. Then there's incentives like $10, $15, $25. So that's great. There's Tobacco Free Colorado as a website, the X program, the Truth Initiative, My Life, My Quit, which is specifically for teens and youth who are hoping to quit. Traditional methods like nicotine replacement therapy and counseling have also proven to be very effective. And again, we also recommend speaking to your doctor or even your dentist, if that's accessible, about a plan on moving forward with quitting.
So I am curious, though, what happens when somebody calls the Colorado Quit line?
Yeah, so they're on the other side of the Colorado Quit line are trained support professionals that are there to coach you through your quit experience. If someone were to call, there's a coach on the other line that's there to really talk to you about what it means for you to quit, and we'll probably talk more about strategies. But yeah, they'll talk you through what the process looks like for you specifically to quit.
Is there anything you think people should know before quitting? Do you have any advice for them?
Yeah, some strategies that we also recommend to folks based on our knowledge is first setting up a really solid quit start date, right? So that might be tomorrow, it might be next week, it might be 2 weeks from now, but really setting that date for when you plan to quit so you can prepare yourself for that. Also knowing your triggers, including high amounts of stressful times, right? Like if you know maybe a trigger for you is you have a work report that's due and smoking helps you to get through that. Knowing what those stressful times are, or maybe it's certain social encounters and environments. I was recently watching the Broncos game in a social environment the other week, and there were so many folks that were using Zins. And I actually thought to myself, this would be such a hard environment for me to be in personally if I was trying to quit, because everyone around me is using Zins and offering them. So knowing what those social environments are, I think is helpful to either communicate with your support system about them or avoid them completely. So knowing those triggers, we would also say finding a really good support system again. So really knowing like who your champions are, whether that's your family, whether it's friends, coworkers, and having that support system set up. And then also finding healthy alternatives. So if, the urges are coming up or withdrawal symptoms are setting in, what are you going to choose to do instead? Maybe it's chewing sugar-free gum. Maybe it's exercising or going for a walk. Maybe it's listening to music or spending time with pets, but really understanding what you're going to do for yourself instead of choosing the tobacco or nicotine product.
Thank you, Destini. I did want to switch over to Nina to find out a little bit more about some of the demographic stuff that's going on. So, Nina, what does nicotine use look like in Larimer County?
So currently, about 6% of Larimer County adults smoke cigarettes. And you look back in time, if you were 20 years ago, that rate would have been triple what it is now. So that's a great success there. About 4% of our high schoolers report currently using, also a sharp decline. But as we've all heard, or many of us have heard, the toll of nicotine vaping has hit youth particularly hard.
How has nicotine use changed in recent years? I know that, Destini, you've talked about vapes and how that's become more prevalent, and so did you, Nina. Is that kind of like a nationwide or national trend, or are there other products that are just becoming, I guess, more marketable or more popular?
Yes. So in 2015, almost a third of Larimer County high school youth reported current vape use. Through a lot of the different prevention efforts that went on in the time since then, we've seen that rate drop to less than 1 in 10 in our last survey of them in 2023. So a huge success there, but still room for growth because that rate is still a little bit higher than the national rate.
I did want to ask, with the passage of things like smoke-free laws and the arrival of things like disposable vapes, how has the impact of nicotine and tobacco use changed over time?
Yeah, that's a great question, Tom, because even though we've seen nicotine use of vapes going down among youth during this time period, there's also been a big growth of new nicotine products, such as larger vapes that can hold large quantities of nicotine. For instance, there's a popular product called Elf Bar, and that delivers as much nicotine as almost 600 cigarettes. So that's like 30 packs of cigarettes that you just hold in the palm of your hand. These products are available in candy or fruit flavors that are especially appealing to youth. It has actually changed a lot over time through policy, and Colorado actually had passed its Clean Indoor Air Act in 2006, so quite a ways back. We take it for granted now, but it prohibits smoking in indoor areas throughout the state. And in 2019, it was also amended to help prohibit nicotine vaping in indoor areas, since nicotine vapors can also be harmful to health when they're breathed in secondhand. And the policy protects both workers and the general public from the health impacts of secondhand smoke and secondhand vapor. And also, just going beyond that protection from those vapors and secondhand smoke, having less people smoking in public places means less peer pressure overall. It really makes it easier for people to quit for good when they're not going to places with everyone vaping or smoking around them. Although Destini did mention the oral nicotine pouches, so I wanted to mention those because those aren't really covered by this type of policy. They can be easily and discreetly tucked under your lip. They're legal for those 21 plus, and people can go about their days and take in large doses of nicotine because there's no reason to take it out. You could go do your workout. You could be at your computer. You could be in your class or hanging out with your friends or socializing in any other way. There's exciting news that the Healthy Kids Colorado survey is actually adding an item about nicotine pouch use. So we'll soon learn more about what's actually going on with it in Larimer County, whether there's certain demographics of youth that are especially impacted by it so that we can tailor prevention programs for them.
So I am curious, deviating slightly from just nicotine, what are the trends for heart disease, though, in Larimer County? And how does that show up in different groups?
Yeah, so actually there have been really promising trends in heart disease in Larimer County. As we know, nationally, smoking is responsible for 1 in 4 deaths due to cardiovascular disease. And we're actually seeing a decline in Larimer County of deaths due to coronary heart disease that parallels the decline we've seen in smoking. So it's really hard at a local level to just measure just exactly how much this is impacting our local cardiovascular health. But when you look at those two downward trends together, and especially when you take into account that our population in Larimer County is aging, it's a population that's even more vulnerable to coronary heart disease, and still we see it declining, we can attribute a lot of that to the decline in smoking, especially among those older adults who have been able to quit. But, there are some patterns in this that are troubling. We see disparities in who's smoking in Larimer County. So those with lower incomes are more likely to smoke than those with higher incomes. And we already know that low-income folks are more vulnerable to chronic disease and all the stressors that compound chronic disease. So it's really important that we help connect these folks with better quit resources, like the Colorado Quit Line, which Destini mentioned.
Well, Destini, Nina, thank you so much for joining us. We really do appreciate it.
Next, we're joined by Kimberly Baker, Larimer County's Health and All Policies Coordinator, here to talk about the 2026 legislative session. Kimberly, thank you so much for joining us.
Thank you for inviting me.
First, can you explain your role at the health department?
Sure. So I follow state, local, and a little bit of federal policy to understand their impact on public health. So day to day, that looks like a variety of things, listening to policy debate, participating in policy committees with other public health professionals, writing letters or testimony to be shared with elected officials and things like that.
That sounds like a big job. How do you keep track of new legislation?
So our department has public health policy priorities, things like public health funding and infrastructure, air quality, immunization access, and health equity and environmental justice. And so I check the General Assembly's website daily to see if new bills have been introduced within those policy priority areas. I also have a subscription to a policy tracking website that helps me keep track of when policies come up in committee and things like that. And then also our colleagues will reach out to me and ask me questions about policy that they see.
So the Colorado State Congress has convened for a new session, which started January 14th. How many new bills were introduced this session?
So far, we have 149 bills. There's usually more than 500, so there's quite a few more that will come.
What bills are you watching so far this legislative session?
So I'm watching a bill to expand the state's cottage food laws, a bill to promote immunization access, and several bills related to mental health care, and several related to AI and data centers, and the list will grow as more bills are introduced.
The first one you mentioned was about cottage food laws.
Yes.
Could you briefly explain what cottage food laws are and how the bill might change those?
Sure. So the current Colorado Cottage Food Act was passed in 2012 to allow limited types of non-potentially hazardous foods to be sold directly to consumers without licensing or inspections. So those non-potentially hazardous foods are those that don't require refrigeration for safety. Under the current law, that includes things like cookies, bread, roasted coffee beans, things that don't have to be refrigerated that are baked, do not include dairy, et cetera. So there's a proposed bill to expand that law to allow for the sale of homemade foods that require refrigeration, and a few other changes. And so we're concerned about food safety risks in this concept. So things like pathogen growth, cross-contamination, exposure to allergens.
You also mentioned there are a handful of bills related to mental health care. How could those bills potentially impact residents in Larimer County?
Sure. So there's a mental health access bill that's been released in the Senate that would create an adult mental health services program, which would reimburse providers for up to 6 mental health sessions with an adult. It's similar to a program that already exists for youth called I Matter. On the most recent Colorado Health Access Survey, 15.6% of Larimer County residents reported needing mental health care that they could not access, mostly due to cost. So hopefully this would help facilitate access to mental health services for adults in Larimer County and throughout the state.
You also mentioned a handful of bills that are related to data centers. AI has probably entered all of our lives in different ways recently. How could those bills potentially impact us here in Larimer County?
Sure. So heading into this legislative session, we knew one of the big topics would be technology, including AI and data centers. There's 2 anticipated bills about data centers that should be introduced this session, one focusing on environmental impacts and the other focusing on data center development and incentives. At this time, only one of those bills has been introduced. And our environmental health planner is paying close attention to the developments because recently the Larimer County Commissioners have put a temporary moratorium on new data center applications within the unincorporated parts of Larimer County. And they're doing this to develop land use standards for data centers within the county.
So for all of these bills that you've mentioned in this legislative session, how do you go about advocating for public health with legislators?
Sure. So our primary goal is to educate our lawmakers about the impact policy has on our population health. And we do this by directly meeting with them, communicating via email or letters, and by giving testimony during committee meetings. I'm also a voting member of the Colorado Association of Local Public Health Officials Policy Committee. And so through that work, we contribute research that gets shared with legislators. And we've provided testimony on bills on a number of topics like keeping youth nicotine and tobacco free, food safety, and restaurant inspections, to name a few.
Are there community partners that you work with to impact policy?
Yes. Other departments in Larimer County, the City of Fort Collins, the City of Loveland, the Health District of Northern Larimer County, United Way, just to name a few. Through our Community Health Improvement Plan work, we convene a group that meets during the legislative session to talk about policies we're following and share information and learn from one another.
For those listening who may want to get involved and advocate for public health at the state level, what would you recommend they do?
Reach out to your elected officials and let them know you support public health. You can testify on bills when they're heard in committee, and you can do that in person, online, or in writing. And also, your elected officials have town hall meetings that you can attend in person, and those are within the community they represent. So they're often at libraries or other public buildings.
Awesome. Thanks so much for joining us.
Thank you.
Thanks for listening, Larimer County. Until next week, stay well, stay connected, and remember, we really are healthier together.